All right. I I want to start today just with a summary of where we are statewide and where we are locally. I looked at the state reports this morning. We're up to three over 360 deaths in Montana. Looks like we're almost at 360 people hospitalized. Those numbers continue to go up. I think there were 27 deaths reported today. That's a and then over 1,000 new cases. I'll tell you our numbers out today are also pretty high in the 130s and 140s, if I recall correctly. I'll also tell you that after the deadline for when we count cases for yesterday, we got another batch of cases that came in that will be counted tomorrow. We were probably pushing 200 cases yesterday overall. They're coming in from all parts of the county. They're coming in from just a number of different places. Just to be clear, we have to cut it off someplace and report the number of cases that we have. Those cases will still be reported. They'll just be reported on tomorrow's numbers. The bottom line is we're just seeing rapid, widespread transmission of the disease. And I'm going to take a minute as health officer to ask for the community's help in a couple of ways. Number one, we need people to stay home or to be in outdoor settings where they're not around other people congregating as much as possible. We need them to stay away from parties and social gatherings. We need people to cancel events that are not essential in order to protect the participants of those events and to slow down disease spread. And I want to emphasize this is about taking care of those who you care about and those you love. The decisions that you're making now are may cause you to come down with this disease a week or two from now. And I want people to think about what they want to bring home when they go home for the holidays. I want people to think about what impact that they're having on this community, the community. And today I'm also going to advise against holding any adult focused social gatherings or events larger than 25 people. I'm not doing that with an order. I'm not doing that with a rule. I'm doing that as health officer speaking to the community. The advice that I have for you is to avoid those sorts of events. Those sorts of events drive transmission. They put people at risk, especially people who are older and have health conditions. And even if you don't fall into one of those categories, being at those events helps drive transmission in ways that puts people in peril. We need people to stay home whenever they can, and I'm going to talk about why in a minute. For Halloween, please don't go to large parties. I've said this before, rent a scary movie, stay home with the people that you're around most of the time, that you live with, that you're close to. If you're going to trick or treat, do so in ways that reduce risk. Being outside helps. Wearing a COVID related face covering that helps interrupt transmission will help. Going in smaller groups, maybe reducing the number of houses that you visit, respecting physical distancing of others, and finding imaginative ways to hand out candy that doesn't involve kids dipping their hands into a communal bowl. And finally, letting the candy sit for a few days. Maybe have a stash that you've acquired that the kids can enjoy while they're waiting, but that virus does not live well outside the body, and just letting it sit can be helpful in interrupting transmission. I'm going to talk about why I'm making these recommendations now. Bear with me. I'm going to share my screen. So in ways that reduce risk, being outside helps. Wearing What's going on, Whitney? That was weird. Can you all hear me okay?
I have no idea. Yeah, we can hear you just fine now.
Okay, so I wasn't super delayed or something? Okay.
I think that was just the ghost of Matt Kelley past coming
Okay.
down on
I
us.
guess so. All right. Halloween theme. Can you all see? Am I sharing my screen now? Can you all see that? Hear me? Okay. So you can see our 7-day rolling average continues to climb. We're at 81 cases per 100,000. That's again a 36% increase over where we were a week ago. Very concerning. And I'm going to get into this a little bit more in a few minutes. We're getting enough cases now that we're not keeping up in contact tracing. We're struggling just to contact the cases that are coming in and identifying high risk close contacts. It's become impossible for us to do contact tracing of all close contacts for all cases. We want the community to know that. We want our partner, we're working hard to communicate with our partners. We're working hard, we're fighting hard to get to everybody we can. We're changing the way we do things to make sure that as we contact people, we're going to be spending less time with those interviews, but continuing to really try and find those higher risk contacts that they have. People who work in nursing homes, people who work in healthcare, people who work with kids in schools, people who live in congregate settings. We want to make sure that we're doing everything we can to get to those folks, get them quarantined and get them supported. You can see the percent positive also continues to climb. We're at a little over 16% now. That compares to just under 14% the last time we did this. We had testing is causing some concern on an anecdotal basis, although I'll say our median time continues to be about 2 days. You can see in this though that we're seeing some instances of a greater amount of time. Some of that will flesh out as time goes on. But on the whole, we're still getting results. We're seeing some indications of some stress in the system. I'm talking to some people who are waiting for 3 or 4 or 5 days, but that seems to be the exception right now. But we're keeping a really careful eye on it, and we're trying to protect that system as much as we can. You know, when you look at the month, we continue to really be able to get to cases within a day, but I'll tell you, just over the last week, that's changed. We're looking for more sensitive ways to show this metric to the community, but we're not keeping up. Bottom line, we're getting more than 100 cases a day. Being able to do those case investigations, you just can't do those case investigations in the same way you would when you have 5, 10, 15, or even 20 cases. So what we're doing is we're changing the way we're doing that work, where our interviews are getting shorter so we can get to more people. And we're emphasizing some of the questions that we think are really important, such as, have you had close contact with somebody who works in a nursing home? Have you had close contact with somebody who works in a school setting? Or do you live yourself in a congregate setting? Making sure we're getting to as many people as we possibly can and identifying those folks who are more sensitive or may work in those more sensitive settings. That's really challenging. We continue to add contact tracers. I oriented another 3 just yesterday or the day before. We continue to look at our processes, and we're really communicating with the community that we need their help, not only in some of the community level interventions that we think are important, like wearing a face mask and social distancing, but we're working with our close partners, both in the healthcare settings, in law enforcement, in emergency management, in education, at MSU, K-12 settings, to make sure they know that if they are seeing a case that they're concerned about, to contact us so that we can prioritize it. Because in a normal time, we get cases in, we try to get those interviews done the first day we get them. And that's become very, very difficult lately. Here's the onset date of symptoms. You can see that people continue to report getting sick and feeling symptoms, and we just kind of keep it, that kind of keeps escalating. Again, that far right portion of that is not yet complete because we haven't done a lot of those interviews yet. And this chart is the same. We continue to see a really rapid escalation in cases of people in their 20s. That has had, has carried over into people in the older age brackets. And some of those ones that are the most concerning are people in their 70s, 60s, 70s, 80s, 90s. We continue to see that rapid increase. MSU, again, they're experiencing this in very much the same way the community is. That 35% increase in cumulative cases at MSU, that's somewhat comparable to what we're seeing, what we're seeing in the community. You notice that's about a 36% increase in the community in our 7-day average. So when you look at what MSU is seeing, it's not out of whack with what we're seeing in the community in general. And we've been looking at that pretty closely with K-12 schools too. And it's, I think that's the same message with K-12 schools. We're not seeing K-12 schools driving transmission, but we are seeing a significant number of cases. This is the active case count that we have in the various K-12 schools. Again, this is active. If you want to look at the cumulative cases, the state is tracking that, and they're tracking that with numbers that we're providing. And then Bozeman Health, the critical care beds are about 80% occupied right now at Bozeman Health. And then non-critical care beds are about 90%. That's an increase of where they were the last time we talked about this. We talked to them virtually every day, talked to them this morning. This really fluctuates pretty rapidly because people get discharged and people get admitted on an ongoing basis. Our partners at Bozeman Health continue to report that they feel like they can continue to serve patients who have COVID and patients who have all needs, and they're very cognizant of what's happening in other cities and other communities around Montana. So, just in general, we're reaching a point now where we're not keeping up with contact tracing, and the number of cases just keeps coming. That's having an impact on hospitals. I am concerned that will have a continued impact on hospitals in the future. And so we're looking at all options. We're really looking at a number of interventions, but right now I want to focus on this coming weekend and making sure that people understand how serious the situation is right now. We've never had more cases. We've never had more people in the hospital, and we've never been at a point where we're not even into November. We're heading into a long winter. And so we really need everybody's help keeping that distance from one another, wearing face coverings, and staying home when they're sick, and being really kind and respectful of one another as we move through this together. So with that, I'd be happy to take some questions.
Matt, this is Freddie Molnadas with the Bozeman Daily Chronicle.
Hey, Freddie.
Hey, I was just wondering, you mentioned that doing investigations of some of the cases hasn't been done. You showed a graph, and the far right of the graph was still sort of blank. I was wondering if you knew how much of a backlog the health department has to investigate.
Well, it's every day when you're getting over 100 cases, we're fighting like crazy to get through as many as we can. But I think, we went home yesterday without getting to roughly 40 cases. We have reported 100. How many did we report yesterday, Whitney? I forget now.
138.
Yeah, we reported 138. Talking to our nurses, there were probably 40 sitting there that we weren't able to get to they came in really late. And so that gives you some sense. What we're trying to do that is make sure that backlog doesn't carry over day to day. That's why we're here 7 days a week. That's why we're adding staff. That's why we've added software. But it is very hard on staff, and it's very hard to keep up. And so that can kind of give you some sense of where we are right now. I wouldn't say, Freddie, that every day has been like that. Yesterday, probably we had more cases yesterday than we've had ever. And so that impacted us, but probably since, this past weekend we came out of this past weekend really knowing we needed to change some of our processes in order to get to people. It's not only that we're not getting to everybody. We're doing what we can to get to everybody. It's just that we're having to stretch and do things in ways that make our case interviews a little bit less lengthy, and that leaves people out of our contact tracing because we're trying to identify people who are highest risk. Another question?
Hey, this is Emma from NBC Montana. Can you hear me?
I can.
So I know you mentioned when you were going over the K through 12 school numbers that obviously they're not driving the spread, but they're kind of experiencing the same thing the community is. So the Bozeman School District is transitioning elementary school in person on Monday, November 2nd. So that's just 3 days away. With the rising cases, is there any risk in them going back? Is there anything they should be concerned about? Or is it kind of just in line with the whole community?
It's important to emphasize that the authority and the responsibility to decide when and how schools go back into session rest with local school boards. And I want to be very respectful of that. And I want to be respectful of a very difficult decision that they have. And I want to note that I serve school boards across the county. There's roughly 15 to 16,000 students in 40 to 60 schools, and we support all of them, and we're committed to supporting all of them in the decisions that they make. We have communicated to all of them on a regular basis that the CDC guidance for school opening, that our current community metrics put us squarely in the highest risk of transmission category in schools. We've communicated consistently that our local epidemiology has been trending in the direction that we wouldn't want it to for weeks, and that in terms of case positivity, case numbers, and hospitalizations. We've also communicated consistently that, having more kids in classrooms will make the disease spread more likely and probably result in more kids in quarantine. And more recently, I have been personally proactively communicating to superintendents that we're having a hard time keeping up with contact tracing, although K-12 schools continue to be a priority setting for us. And so we can identify those, we're pulling those out of the stack. And we're looking for those within age categories too. It's also important to note though, that when we look at the rate of disease transmission in schools, that doesn't appear to us that schools are driving the pandemic. And that's where the health department would really be most likely to step in. If we saw a particular school or a particular school district where the disease was spreading at a rate that was out of whack with what the community was, and it was putting the community transmission at risk, then we would be more likely to step in and say, hey, we might want to take a break here. But we're not seeing that in schools right now. It's just important to understand that it's this, we need the school boards, when they make that decision, it's not just those community level indicators that we're providing. It's not just about the disease epidemiology that we're providing. It's also decisions about staffing. It's about parent input. It's about their ability to keep schools open. And it's about the judgment of the trustees who are elected to run those school districts. And so I want to make sure I'm being respectful of that, but I also want to be really clear that when you have this level of disease in the community, having more kids in classrooms is likely to result in more risk of disease transmission. So I'm going to be very careful about how I talk about this, because I'm serving schools all over the county who have all made different decisions. I think my job is to provide them with the best data that we have and make sure that I'm available to them if they ever want to talk about that data. And that's what we're trying to do, rather than dictate those decisions to them. Gabrielle, did you have a question? I thought your hand went up there.
Yeah, I did. I'm Gabrielle with Explore Big Sky. And I was wondering, there's been talk up here in Big Sky of implementing surveillance testing. And I was curious to know what current guidance is out there for surveillance testing, and if you think that that is an effective measure.
Yeah, so we have been in touch for a long time and multiple occasions with the resort tax district and with some officials with some of the resorts and some of the larger employers in town. And they're very interested in implementing surveillance testing as a way to identify cases and reduce transmission, and they want to keep operating. And we've been supportive of that. We've been really clear that the health department can't do it ourselves. We're at capacity now, just dealing with the stuff that we're dealing with. I've said a couple of things to them that I know that they've taken to heart and they've acted on. One, any surveillance testing, we need to make sure that the tests that they're using are reliable, and that they're validated by the state health department. And number two, we need to make sure that any testing system that is put in place has a capacity to report the results to the state health department so that they can be assigned to local counties and that contact tracing can happen. And that's even more complicated in Big Sky because you're dealing with two different counties. You're dealing with Gallatin County and Madison County. And so having that reporting mechanism to the state health department is really critical, because we need to make sure that cases are assigned to the right county and we're following up. So in general, if the test is reliable and if the results are reported to the public health system, we'll be supportive of doing that surveillance testing. And the folks in Big Sky that I know are really interested in this have been very receptive to that message and have really had us involved in those conversations from the beginning. So I want to, the other thing I've told them is surveillance testing is not a panacea, and it does create, it can create some problems. But in the current environment we're in, where we have fairly high prevalence of disease, I'm less worried about those problems. I mainly want to make sure that the test is reliable and that once we get results, we're able to really do something with it that matters. And if we can do those two things, then I think that there's definitely a place for surveillance testing in our response. Ready?
Yeah, I have sort of two questions. I was wondering if you could clarify the news release announcing the woman in her 90s who died because of complications from coronavirus. You said that she died at home, but that she was a resident of long-term care facility. Did she die at the long-term care facility, or did she die somewhere else?
She died at her home, which is a long-term care facility.
Okay, and could you release what long-term care facility that was? Or
no, we're not doing that, because some of those long-term care facilities are so small that we end up giving up the confidentiality of the people who live there. So we're not. Some of them are doing that themselves, but we're not going to do that for them.
And then one last thing, you're talking about the strain on the system and sort of struggling to keep up with contact tracing. And I was just wondering if you were considering, because of that, implementing any stricter restrictions anytime soon, or.
I think it's something the community needs to look at pretty soon. I don't know that there's been no decisions made. We are asking for everybody's cooperation, but I think we need to have all options on the table, especially if we can't get these numbers under control fairly soon, because my concern is, I'm concerned about what's happening around us. If you look at, I was reading this week about, in Idaho Falls, Twin Falls, Idaho, where there's a hospital with about 1/3 of the patients are COVID-19 positive. Administrators are sending children who need hospitalization to hospitals in Boise. And so the governor now is coming in and introducing some limits on gatherings and doing some mask mandates that we've been doing for some time. In North Dakota, I read they were down to a couple dozen, maybe a few dozen unoccupied ICU beds earlier this week or last. And the mayor in Fargo, North Dakota, was using his emergency powers to implement the first mask mandate in the state. We're seeing, there was some news coverage on the national news this week about the ICU in Billings. We've seen concerns arising around Great Falls and Helena. And those things really concern me. And I don't want to wait until we get into those circumstances to try to act. But I also don't want to leave the impression that, we can solve this through health department passing rules. If that happens, it'll be a part of the solution, but it won't be enough if we can't get the community to really take this seriously and really stay home when they can and keep that physical distance from others. Other questions? Okay, I appreciate all your time. We'll be in touch, and we'll keep doing this as we move forward. I hope to have better metrics to share with you one of these weeks, but things are pretty rough right now, and I appreciate your time.
Thanks, Matt.
Thank you.
Thanks, Matt.